Health Secretary. This is Matt Rodder, who's the Labour MP for Reading East. Morning, Matt.
Good morning.
Good morning. You, I know, have been talking to care homes in the Reading area. What are they saying to you about the situation they're dealing with?
If I could just correct you for a moment, Andrew, I've been speaking to the NHS and the local authorities, and I'm about to, do a ring round of care homes.
Okay.
The problem is exactly as the questioner in your clip describes. Care homes appear to have been underfunded. Local authorities, staff, care home owners are doing everything they can, but there's a serious issue with the lack of testing and PPE in care homes. So, for example, I'm due to write to Matt Hancock and set this all out to him so he knows exactly the picture in our part of Berkshire, but it is very worrying. So, for example, I've picked up from some of the trade unions that staff in some areas of Berkshire have only been issued with gloves for personal care for elderly people, but not for other tasks. And the testing, it appears that the government is relying on a testing centre in Oxford, which is obviously quite away from Reading and from the rest of Berkshire. The local NHS believes that local testing should be a priority.
Right, so just picking up those couple of things, there are test centres in Thatcham, Reading and Ascot. And I've heard as well that a lot of people who are applying on the government website in this area are being sent to Oxford. Do we know why?
That's one of the things I'm trying to discover. I've had reports from residents in East Reading that the early gate facility at Reading University hasn't been as busy as it could be. And I suspect the issues with the government and the approach they've taken, which seems to be to want to centralise testing, and certainly for many medical staff, a 2-hour round trip to Oxford from Reading, or indeed from other parts of the county, is unrealistic.
Well, I've certainly had people contact me who work in different parts of the healthcare system saying, you know what, I'm working really hard, life's hard enough, I don't have hours and hours of my own spare time to spend getting online, booking a test and then travelling a long way and then waiting when I'm there and having the test. It doesn't seem worth bothering to me, which I suppose is understandable, but not the approach that we're trying to get from people.
And that is the point. So we need to make sure that testing is actually very local for staff and residents of care homes, and indeed for other health and care workers and other people who need to be tested. It needs to be appropriate, convenient, and quickly turned around, not relying on a large remote facility that's some way away. I think you could also think about the pressures on care home staff who maybe haven't got a car trying to get to Oxford at the current time. It's obviously going to be harder and will take longer by bus.
Do you think, although there have been delays, do you think that people who are working in our care homes have got the equipment they need now?
I think there's a patchy position. So what I've picked up from the local authorities and others is that the deliveries of PPE have been unreliable. They're often only managing with enough stock to keep them going for a couple of days ahead. So it's very hard for them to manage and to cope. And people who are health professionals are often having to ration the amount of PPE they're using. So the example I gave about the gloves came from the GMB union, talking to members locally. And obviously it's very concerning because those staff themselves could become infected. And we've heard about the terrible consequences of I also want to pay tribute to the consultant who passed away in the Royal Berks, who raised concerns about PPE. Now, hopefully that's now being addressed in the hospital sector, but across both health and social care, we need to make sure there's a better availability of PPE, and the flow of gloves and gowns and everything else is predictable, so that hospitals and care homes and others can plan the use ahead over several days, not waiting for a delivery. It suddenly comes, and what they've sometimes discovered is that it's the wrong materials, or they're getting too many gloves or too many visors. It's not a balanced pack of materials.
OK, Matt, thank you. That's Matt Rodder, who's the Labour MP for Reading East. This is Kerry.